Case 11, 2016. A 12-year-old boy with malaise, fever, abdominal pain, and pallor. Definition: a 12-year-old boy was admitted because of malaise, fever, and abdominal pain, and worsening pallor. The patient had been well until 1 month before admission, when the abdominal pain developed. Examination by the school nurse revealed a temperature of 38.6 degrees and pale skin. The skin was pale, it was slightly erythematous, and the abdomen was tender. On the day of admission, the patient reported headache, nausea, and pain in the right upper abdomen and left leg. He traveled to the Dominican Republic laboratory. Evaluation revealed anemia and elevated C-reactive protein level. Diagnostic tests were performed.
So, abdominal pain is a very broad topic because we have a lot of organs in our abdominal cavity. All of them can have different types of pain or different locations of pain. So, when you talk to your doctor about saying that you have pain, it's important to talk about the character. If it's a sharp pain, or a double pain, or a cramping pain. If it's located in the right upper quadrant, or in the epigastrium, the left upper quadrant, or the left lower quadrant, or the right lower quadrant. And if it's associated with any alarm symptoms, most commonly pain within the abdomen, which is in the right upper quadrant, could be called back pain. Epigastric pain, which is right in the middle of your abdomen, most likely is a stomach type pain. On the other side, left upper quadrant pain, most commonly is related to gas pain because that's where a lot of the air rises and it causes a lot of stretching and pain in that region. When we're talking about the right upper quadrant, we're worried about the appendix because that's one of the most common causes of pain in that area. The left upper quadrant is the most commonly due to diverticular pain. And it's important to mention all of these locations and the quality of the pain because it helps the doctor diagnose the cause of the pain and help them with the treatment therapy.
Pros and cons. Anemia is a condition in which your blood has a lower than normal number of red blood cells. Anemia also can occur if your red blood cells doesn't contain enough hemoglobin. This protein helps red blood cells carry oxygen from the lungs to the rest of the body. If a person has anemia, the body doesn't get enough oxygen-rich blood. As a result, you may feel tired or weak. You also may have other symptoms, such as shortness of breath, dizziness, or headache. Severe of long-lasting anemia can damage your heart, brain, and other organs in your body. Very severe anemia may even cause death.
At Capital Regional Medical Center's emergency department, we recognize that if you're having a headache or severe belly pain, that's something that's very concerning to you. It's concerning to us as well. We want to treat it as efficiently as possible and get you feeling better. One of the things that we may ask early in your care is to provide a urine sample. This is an important part of the care for both headache and belly pain, and it helps speed the process up. So the nurse may ask you in the waiting room, they could ask you in the triage area, or anytime you feel like you have to go, let your nurse know. There are some other innovative things that we're doing to improve the efficiency of the care for patients with abdominal pain and or headache. Some of those really rely on improving the visual cues for the ER physicians and nurses. We right now have a tracker that we use. It's an electronic dashboard that shows us time frames so that we know we have visual cues on when to reassess a patient, when diagnostic tests have been completed, and that really helps speed up the process. Our goal is to get you feeling as comfortable as possible to ensure that you're safe and that we make the appropriate disposition. That means either admission to the hospital or discharge to home. If you are discharged, there may be a requirement for a specialist to see through your care. That specialist would be referred by the emergency department physician, and the information for that specialist would be provided by the emergency department nurse at your discharge. They would give you printed information and verbal instructions that would help guide your path after you leave the emergency department.
Issue apply in Ecuador. Iron deficiency is one of the nutritional problems in Ecuador. It is estimated that 70% of children under 1 year old suffer of anemia, especially those who are living in rural areas of the mountain range where the figure reaches 84%. Application in medicine. Treatment may include taking iron supplements and eating iron-rich foods. Iron supplements are required to accumulate reserves of this element in the body. Most of the time, your health care provider will measure the level of iron before you start taking supplements. If you cannot tolerate oral iron, you may need to receive it through a vein intravenously or by intramuscular injection. Pregnant and lactating women need to take extra iron because they often cannot get enough from their normal diet. The hematocrit should return to normal after 2 months of iron therapy. You must keep taking iron for another 6 to 12 months to replenish the body stores of this element in the bone marrow.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has 3 main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid or vitamin B12, blood disorders such as sickle cell anemia and thalassemia, or cancer, aplastic anemia, a condition that can be inherited or acquired, and G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
Conclusion. Often you can treat uncontrolled anemia if you have signs of symptoms of anemia. Seek prompt diagnosis and treatment. Treatment may increase your energy and activity levels, improve your quality of life, and help you live longer. With proper treatment, many types of anemia are mild and short-term. However, anemia can be severe, long-lasting, or even fatal when it's caused by an inherited or chronic disease or trauma.
You look super pale. Slept all day, huh, sis? Still not feeling well? Want a cookie?
So, Mika, your dad told me that you've been sleeping all day. How are you feeling now?
I feel like my heart is coming out of my chest.
Okay, let me give you a checkup and see if I can help you get better. Okay, I've done the test, and I'm afraid Mika has anemia. It's a lack of red blood cells in her blood. Is it bad? Not if you treat it early. Let me show you. Red blood cells carry oxygen to all parts of the body. When they are low, less oxygen is getting around the body. This can make a person feel tired and weak. It can happen if iron or other foods are not absorbed correctly, or not eating enough iron-rich foods. This may result in bleeding in the mouth, esophagus, stomach, or intestines, vaginal bleeding, or heavy menstrual flow. Babies less than 1 year old can also have anemia. if they are fed cow's milk, goat's milk, or formulas without extra iron. Anemia takes a while to cure, and you'll need to watch your diet. Eating healthy meals with fruits, vegetables, breads, dairy products, meat, and fish with plenty of iron-rich vegetables, red meats, nuts, and beans, and drinking 6 to 8 glasses of liquids a day will also help. In extreme cases, a blood transfusion may be required to replace the lost iron. Watch for these signs of trouble. They could be signs of anemia.
Remember, always talk to your doctor or nurse if you have questions or concerns.